My name's Brooke Shelly. I'm PSA National Board Director. I've recently started on our executive team, and from the 1st of July I started as the lead negotiator for the first pharmacy programs agreement. Essentially, most lay people would know pharmacists work in community pharmacies, and they wear the white coat and they're very accessible parts of the health system, allowing us to have access to medications. They have an excellent set of skills and allow for patients to come in 7 days a week. There are a lot of pharmacies that are open through till midnight. There are also a huge subset of pharmacists that work in other areas. Some of the pharmacists are called consultant pharmacists, and they perform the home medication review and residential medication management review programs. Essentially, these are medication safety programs, and those are to ensure that the access is there, but the safety is there as well. So we know that medicines, when they're used properly, are life-saving. We also know that when medicines are misused or inappropriately prescribed, they can be dangerous. So the work of consultant pharmacists is basically in the medication safety space. Those patients are seen in their own home, and essentially residential aged care facilities are the patient's home at that time in their life. The consultant pharmacist goes into the home or into the facility and speaks to the patient one-on-one, sometimes with their family, sometimes in multidisciplinary teams with the GP. And essentially what we found was there are challenges when we need to close that loop. So these pharmacists go into patients' homes, they write a report and recommendations for the GP, and sometimes we're unable to see what the outcomes of those recommendations are. The government allowed us to do follow-ups for these services, and to go into the patient's home a second time for half of the remuneration meant that we weren't seeing that wraparound care occur. So having the ability to do that via telehealth really brings us in line with most of our other medical colleagues and other non-GP specialists who are able to use telehealth. We saw a really successful rollout of that through the pandemic, and home medication review pharmacists were able to do that, and then that was taken away. So it was a huge win for us yesterday to have Minister Butler announce the reinstatement of telehealth, so that patients that perhaps are in rural areas still found themselves in line with those in metro, because we often see that if you have to drive a distance and you don't have the remuneration for that, the pharmacist just cannot make those decisions to be able to go out and see those patients as often as they would like. PSA 26 has been an incredible conference. It is the home of pharmacy, and the conference theme has been so excellent in showcasing the real sense of community that pharmacists have when we come together as a discipline. It has been such a wonderful feeling to have conversations with members that really assures us as elected officials that we are doing what the membership wants for us. The membership is our eyes and ears. They let us know what it is that we should be working on as their society. They're the eyes and ears of the community as well. So essentially it's not about PSA. It's not about the pharmacists, it's actually about the patients that we all serve. So the announcement at this conference, which allows greater access, greater flexibility for patients to be able to receive these medication safety programs, has been really well received by our members. We know there's more work to do. Minister Butler signalled at the conference that he knows there's more work to do, and we're really looking forward to wrapping up this first pharmacy programs agreement and delivering for our members of the PSA. From the 1st of November, pharmacists will be able to pick up the phone and make a call to their patients to see how the outcomes of the initial home medicines review or residential medication management review is working for them. It's an exceptional thing for pharmacists to be able to do that full wraparound care. We just weren't seeing it happening. At the end of the day, pharmacists need to be able to put food on the table for their own families. The remuneration hasn't kept pace with CPI, and we haven't seen indexation since 2019. So to be able to have this productivity piece where instead of having to drive again to the home, we've already been the eyes and ears for the GP, we've seen the home setting. There's no need for us to present to the home unless there's something we want to see physically. So to be able to do this via telehealth really is a productivity piece, but it's an access piece as well. We really need to have a full workforce that's able to do this work, and telehealth is really going to allow for them to be able to do that in and around the care that they provide for their families or elderly parents, and be able to do that in a way that patients understand. Patients really appreciate the access that telehealth affords them, but equally they do like that one-on-one. So this is a beautiful hybrid model, I suppose, that allows some flexibility, which is essentially what we've been asking for a period of time. PSA is the home for all pharmacists, and we are in the advocacy space for all pharmacists in all areas of practice. We know that consultant pharmacists want and need to do more for their patients, and telehealth was a really important announcement made by the Minister at this conference to allow for that to occur. The journey has been a long one, however, and these services have been around for 25 years, and in terms of how indexation has occurred over that time, it's been haphazard at best, so there's still work to do. Indexation and caps are things that we are aggressively pursuing with the government, and we saw the announcement from Minister Butler it was certainly signalling to us that it is something we should continue to work with him on. The First Pharmacy Programs Agreement is a landmark agreement for the PSA. It's the first time that these 17 programs have been removed from the Community Pharmacy Agreement, which is negotiated with the Pharmacy Guild of Australia and the Australian Government. So this agreement that sits with the PSA is the first of its kind, and I'm really privileged to be driving this work on the background of Shane Jackson and Debbie Rigby as well over the period of time that we've been negotiating for this agreement. Minister Butler signalled at the conference that he is keen for this agreement to be signed as soon as possible, and certainly so is the PSA.